We have a fairly large cardiovascular training unit in our geriatric and seniors advanced massage and bodywork course, and that's because there are quite a few contraindications when working on geriatrics due to cardiovascular reasons, and I want to share with you right now a reason why. We're going to review a medical error that occurred during a simple 5-minute abdominal massage. Now, when we provide CE classes to our students, the boards require us to take surveys from our students once they complete their training with us. And every year we'll get a student or two, and this is out of thousands, that will say, I don't agree with your instructions because massage can't really hurt anything, and I'm going to massage the client without asking a doctor and some other things. And it really frightens me because those types of practitioners could do a lot of harm. Massage can produce medical errors and medical problems and even death. So it's really important. I'm not here to scare you. I'm here to educate you and tell you that there are certain conditions that you need to use caution with, and some conditions that are even contraindicated. Let's review with what happened with this individual who had an abdominal massage. This person it was a 65-year-old man, and he had an upset stomach. They categorize it as dyspepsia. Okay. And that was for 5 days before he saw what they're calling a local healer. And after he went to a local healer, he presented with this. You can see the toes here, the fourth and fifth toe are swollen and discolored. That's an obstruction of blood flow. And they also did various blood pressures throughout the body and found that this lower extremity had a very concerning blood pressure. Okay, what they did is they did x-rays and ultrasound, ECGs, and so forth to find out what had happened to this individual. And he did present to the hospital. He had probably been in pain, I believe it was about for 6 hours before he went to the hospital. And if you read in the case presentation here, he had the upset stomach for 5 days. And the healer, they're calling them the healer, gave this 65-year-old man a vigorous and deep abdominal massage for 5 minutes, just 5 minutes. And they focused in the epigastric and umbilical areas of the abdomen. And they used the heel of the hand. Now, we teach an abdominal massage for geriatrics for constipation, but we're never really working that deeply. We do not want to press deeply into the abdomen on a geriatric. And, in this case, this is why. This is a peripheral embolization after 5 minutes of abdominal massage. And the learning points and discussion in this medical error are patients will often seek massage for pain. And in this case, the guy had an upset stomach. I wouldn't necessarily call that pain, but instead of seeing a doctor, they went to a massage therapist or healer instead and had an abdominal massage. And their conclusions and learning points from this medical error, and it's the second point right here. It said elderly patients or patients with significant arthrovascular disease should be advised to consult a physician before taking massage therapy. The third point is even minor trauma. I wouldn't call an abdominal massage minor trauma unless it's as deep as whatever this healer did. They said even minor trauma can dislodge thrombosis or disturb an unstable plaque. So when your client has atherosclerosis or blood clots or thrombosis and so forth, it's really contraindicated to massage some of these conditions, especially without physician approval, because if they're unstable, they can travel to the heart or brain and cause stroke. And in this case, There was a blood clot obstructing circulation in the lower extremities to the point that they're experiencing what will likely become tissue death and necrosis with this discoloration of the skin. So this is why it's really important, especially with working with geriatrics or any special at-risk population, to train and learn more about working with them so you can learn the massage do's and don'ts, what's contraindicated, when you should have precautions. And with geriatrics, there's a lot of cardiovascular conditions that you should be made aware of and trained to work with, and know when you shouldn't work with them as well. If you like this type of free information, please like us and follow us on this YouTube channel so that we can continue it with your support. It costs nothing, but we'll know that you like it so that we can continue doing it for you. If you want to learn more about geriatrics and working with them, we do have geriatric training available for massage, bodywork, and hands-on complementary medical techniques in our geriatric CE course offerings at ceinstitute.com. Until we see you in one of our trainings, be safe.